Have you ever found yourself just endlessly searching for a family doctor, hitting those walls?
Oh, absolutely. Or you know someone, right?
Yeah.
A friend, family member, stuck on a waiting list for months.
Exactly. It feels like such a common story now for millions of Canadians. And it's more than just annoying, isn't it?
It really is. It points to something much bigger.
Okay, let's unpack this then. We're diving into a pretty critical issue today, one that's kind of quietly reshaping healthcare for so many people. Canada's growing family doctor crisis.
Hmm.
And our mission here is to use some new research from the Canadian Family Physician Journal, actually, to get to the bottom of it.
Yeah, explore the roots, the impacts.
Right, and maybe even some surprising impacts, but also, importantly, the innovative solutions that are already being tried out.
Definitely need to talk about those.
The goal is for you, listening, to really get a handle on what's happening with primary care and, what it could mean for your own access to healthcare down the line.
Right.
So let's start with that big picture. Primary care in Canada, it's in trouble. What's the general trend with family doctor numbers? Is it like a slow leak, or are we seeing something more significant?
Well, what's really fascinating and frankly quite concerning is the stagnation.
Stagnation. How so?
Between 2019 and 2022, the actual number of comprehensive family physicians, the ones providing that broad ongoing care, it basically stayed flat,
Hmm.
around 9,375 across the country.
Wow, flat, not even keeping up with population growth.
Exactly. That's unprecedented. And even more stark, for the first time ever, we actually saw a decline in early career doctors, those under 35 choosing this path.
A decline in young doctors. That's worrying for the future,
It is. And there's another shift happening too. Women now make up the majority of the workforce.
which is great in terms of representation.
Absolutely. But due to various systemic factors, workload expectations, things like that, they often tend to have smaller patient rosters. So the overall capacity per physician might be changing too.
Okay, so stagnation, fewer young doctors coming in. And you mentioned demographics. This leads to the aging physician challenge. That sounds, well, challenging.
Mhm.
Is the issue that older doctors are less capable, or is it more about them retiring and the gap they leave?
Oh, it's absolutely the latter. It's about the massive void they leave. In 2022, get this, over 15% of these comprehensive family doctors were 65 or older.
15%. That's huge. How many patients is that?
They were serving nearly 1.74 million Canadians combined. And if you look even older, doctors aged 70 plus, they make up 7.2% of the workforce now.
70 plus, still working. Wow.
Yeah. And the key insight here isn't just the numbers, it's what they represent. Decades of experience, deep community ties.
Right, that institutional memory you mentioned earlier.
Exactly. These seasoned doctors often handle the most complex patients, people with multiple chronic illnesses, serious mental health issues, complex social situations.
The ones who need that continuity the most.
Precisely. So when they retire, it's not just a doctor leaving. It's a loss of deep trust, clinical wisdom, things that are incredibly hard, almost impossible to replace quickly. They're like community anchors.
Okay, so we've got this aging workforce, fewer young replacements, choosing comprehensive care, flat numbers overall. It paints a pretty clear picture of a system under real strain.
Hmm.
What pushed it over the edge? What made it worse? I mean, I have to ask about COVID-19. Did the pandemic just throw gasoline on the fire?
It absolutely did. Many doctors used to practice well into their 70s, quite happily.
Yeah.
But the pandemic,
Yeah.
the sheer burnout, the psychological toll, the constantly shifting rules, the paperwork piling up,
It must have been immense.
it pushed some to think about retiring much earlier, even as young as 55. It forced a lot of doctors to really question their long-term commitment to the demands of comprehensive family medicine.
And that created a kind of mismatch, right?
A total paradox. The system desperately needs more generalists, more comprehensive care providers. But we're seeing younger physicians increasingly drawn to more focused practices.
Like hospital work or emergency rooms.
Exactly,
Yeah.
or specialized clinics, which means fewer are available for that continuous relationship-based care that's, the bedrock of primary care. It's a fundamental misalignment right now.
That really highlights the pressure. The pandemic forced a lot of people to rethink things. So, okay, flipping this around,
Mhm.
what does all this mean for patients? You mentioned complexity earlier. Is the demand side just getting harder too?
You've hit on something really crucial there. The demand is growing. and it's becoming more complex. Physicians today are dealing with patients who have much more complex needs across all ages. We're seeing rising rates of chronic diseases, significant mental health challenges, and also those social determinants of health, things like poverty, housing insecurity, language barriers for newcomers.
Things outside the purely medical scope, but that massively impact health.
Precisely. Think about caring for frail seniors with 5 different conditions, or helping a new immigrant navigate the system while dealing with trauma, or supporting someone facing homelessness. It all makes delivering care much more demanding, much more time-consuming. It's a tougher job than it was even 10 years ago.
Wow. So demand is up, complexity is up, supply is stagnant or shrinking in key areas. Well, that's a lot. It sounds pretty bleak.
It is challenging. There's no denying that.
But it can't be all bad news, surely. Are there bright spots? Are clinics, communities trying anything new? I'm hoping for some optimism here.
Yes, absolutely. And this really brings up an important point. The scale of this crisis means we can't just rely on old policy levers or wait for things to fix themselves.
We need a different approach.
A multifaceted, system-level response.
Yeah.
And actually, across Canada, clinics and communities are stepping up with innovative ideas.
Okay, like what?
Well, there are organizations like Healthion, for example. They're working directly with clinics and health teams,
Doing what exactly?
exploring really practical ways to cut down on administrative tasks, support doctors in rural areas, expand patient access. And this is key, doing it within the public system, strengthening it, not replacing it.
That sounds really promising. Can you give us some solid examples? What are these innovations actually looking like on the ground?
Definitely. There are several key areas showing real promise. First, reducing that admin burden.
Oh, the paperwork. Every doctor complains about that.
Right. So clinics are using technology much smarter now, streamlining appointment booking, billing, sending out routine reminders automatically.
And freeing up time.
Exactly. It lets doctors focus on actual patient care, not forms. And it genuinely helps reduce that burnout factor we talked about.
Okay, what else?
Second, expanding access to expertise, especially in smaller communities. Family docs might need a quick second opinion or some specialist advice. Third, and this is huge, enabling team-based care.
More than just the doctor.
Way more. Bringing in nurses, pharmacists, social workers, mental health professionals, admin support, all working collaboratively.
So the doctor doesn't have to do everything.
Exactly. But Family Doc can focus on the most complex medical diagnosis and treatment, while the team provides broader support, medication management, counseling, navigating social services. It ensures patients get comprehensive care. It's about working smarter as a team.
Makes sense. What about the money side, especially for rural clinics?
Good question. That's the fourth point. Supporting financial sustainability. Clinics, particularly in underserved areas, are finding better ways to manage things like uninsured services or optimizing how the practice runs financially.
To make sure comprehensive care is actually viable long-term.
Yes. And crucially, keeping it viable within the public system. Not forcing privatization, but making the public model work better.
Okay. And you mentioned rural access specifically.
Yes. Fifth point, strengthening rural access. This is critical, with millions lacking a doctor, often in remote areas.
So what's being done there?
Piloting new hybrid models, a mix of in-person visits and virtual care. Also, building stronger partnerships within the community to boost local capacity. Maybe sharing resources between towns.
Those all sound like really practical, concrete steps, not just abstract ideas.
They are, and they're being tested right now.
And are they working? What are the early results like from some of these initiatives, maybe the ones Healthion is involved with?
Yeah, the early results are genuinely positive. Very encouraging.
Like what? Can you share specifics?
Sure. In communities where these kinds of innovations have been implemented with support from groups like Healthion, we're seeing things like measurable reductions in patient travel time.
Which is huge, especially rurally.
Massive. And also a noticeable increase in things like preventative care visits, checkups, screenings.
So catching problems earlier.
Exactly. These outcomes really point to the potential here. Scalable, community-led innovation can make a real difference. It shows solutions are definitely within reach if we're willing to rethink how we deliver care.
Okay, so bringing this all together, what does this mean for you, the listener, and the future of healthcare in Canada? It feels like these findings aren't just data points, they're a real wake-up call.
They absolutely are a profound call to action.
Yeah.
If we connect this to the bigger picture, It means we just can't afford to wait for long-term plans alone or just hope the old models magically bounce back.
We need action now.
We need urgent support for physicians now. We need to strengthen those primary care teams now and fundamentally rethink service delivery to match today's needs.
Hmm.
But the encouraging part is the tools are there. The insights, the partnerships, like the ones we've discussed, they exist. We can build a more responsive, resilient, and importantly, equitable primary care system. We just need the collective will to implement these solutions more widely.
Right. Get them scaled up.
Exactly.
So, to leave you with something to think about after this deep dive, what would a more responsive and resilient primary care system actually look like and feel like for you personally? And maybe, how can understanding these changing models of care empower you to navigate the system better, or even, advocate for improvements right there in your own community?
Thank you for listening. This is Prescription for Primary Care, wishing you good health and better health care.